Thanks, Deputy Speaker. Firstly, I'd like to recognise Dan Lawler, Canberra Hospital's Chief Pharmacist, for his recognition in the King's Honours Awards just last week. In a previous life, Deputy Speaker, I represented both hospital and community pharmacists, and it was a real privilege. Across the country, our community pharmacists do an enormous amount of work in our local community. They were at the front line during the COVID pandemic, during the Canberra bushfires, and every day they work with their patients to ensure they're getting their medicines and that they're being cared for. People rightly perceive pharmacists as highly reliable advisors on many personal health matters, trustworthy independent sources of healthcare products and steadfast partners of the medical profession and other allied health professions. This has been clearly shown in national and international literature on consumers' views and experiences of community pharmacy practice. It accords with my own experience. My local pharmacists are critical for healthcare delivery in Bean, and I want to thank them on the record for all they do. I want to thank them for supporting my constituents with their vaccinations, their blister packs, their basic medical needs, and right through to their outreach in our aged and disability care communities. I also want to thank my local pharmacists for spending their valuable time meeting and briefing me on our government changes on dispensing and the government's reinvestment into community pharmacy. The policy intent of 60-day dispensing is sound. We all want people visiting the doctor less often, saving time and money on dispensing and having more funds reinvested into our community pharmacy network. As many people would know, the government is driving this policy intent by delivering cheaper medicines through 60-day dispensing for more than 6 million Australians. This will halve the cost of medicines for millions of Australians, including pensioners, many of whom have been living with chronic conditions for years. And it's worth noting that in January this year, Labor cut the price of more than 2,000 brands of medicine, delivering $130 million back into the pockets of hardworking Australians. Introducing 60-day prescribing for stable, ongoing conditions isn't a new idea. It was a recommendation of the clinical experts at the Independent Pharmaceutical Benefits Advisory Committee back in 2018. The government is committed to supporting better access to healthcare for all Australians, including through critical services provided by pharmacists. Every single dollar that will be saved by the government from lower dispensing fees paid to pharmacies will be reinvested back into community pharmacy practice, funding services that will directly benefit patients. From January 1, Australians eligible for the National Immunisation Program will be able to get their vaccine from their pharmacy for free. The government will pay the pharmacy per vaccine administered. The NIP is an uncapped program, and in fact demand is likely to increase over time as more vaccines are added to the NIP and the Australian population grows. The PBS opioid dependence treatment program will broaden access to treatments in community pharmacies from 1 July 2023. These programs alone will mean nearly $500 million will be invested by the Albanese government into community pharmacies over 5 years. The government is also investing $350 million to community pharmacy outreach into aged care facilities to ensure older Australians are managing their medications. In addition to this, more than $650 million in additional funding for community pharmacy programs will ensure patients can access critical medication management and dose administration aids programs through community pharmacy. That said, Deputy Speaker, I've been made aware through my meetings and correspondence with my community pharmacies of some of the many implementation challenges and the cost impacts of the changes of 60-day dispensing. I'm concerned that it's critical that our local pharmacists who want to keep doing their valuable work, that they need that support in terms of doing that service as these changes transition through. I note that the government continues to work with all parts of the pharmacy sector on the implementation of this policy. This includes an invitation to the Pharmacy Guild to engage in constructive discussions with the government on the implementation of the policy and the significant reinvestment of funding in the pharmacy sector. These ongoing discussions are important. I'd urge all parties to continue to work together. I'll continue to engage with my local pharmacy community, but I support these proposed changes to 60-day dispensing.